Hello, my name is Christopher Bristow,
And my name is Michael Solomon.
and we are doing a research article critique on why do patients in acute care hospitals fall, and can falls be prevented?
We chose to do this article because of the major impact falls have in the world. According to the CDC, falls are a major public health problem. An estimated 424,000 fatal falls occur each year, making it the second leading cause of unintentional injury or death after road traffic injuries. 1 out of 5 falls causes a serious injury such as broken bones or a head injury. Each year, 2.5 million older people are treated in emergency departments for fall injuries. Over 700,000 patients a year are hospitalized because of a fall injury, most often because of a head injury or a hip fracture. Falls are the most common cause of traumatic brain injuries. Adjusted for inflation, the direct medical costs for fall injuries are $34 billion annually. Hospital costs account for 2/3 of the total. The researchers first mentioned that falls are a serious problem in hospitals and that falls are used to measure nursing care quality. This research article examined factors related to patients falling in an acute care hospital setting. The research is placed within a well-known issue that has unfortunately yet to be solved. They mentioned that although there have been many quantitative evidence-based studies in fall prevention, falls remain a major public problem in acute care hospitals. The purpose of this research is to obtain the opinions of nurses and nursing assistants as to reasons why patients in acute care hospitals fall. The investigators conducted a review of fall prevention literature on databases from 1982 to November 2008 and found an abundance of research, most of which was current. The research uncovered many risk factors for falls. However, assessments do not prevent falls, interventions do. Although there are many fall intervention methods, they found that the effectiveness of interventions was inconclusive. This helped us gather a better understanding of why they were conducting the research and showed the importance of the study. This study will not solve the problem completely, but if the information can translate into interventions and strategies, then it may decrease the number of falls if applied in acute care settings. The purpose of this study is to obtain the views of medical staff, nurses, and nursing assistants as to why they think patients in acute care hospitals fall. Since this is a qualitative study, there is no theoretical framework stated in this research piece. The researchers wrote about how designing experiments to study fall interventions are difficult because once a risk assessment has been established, it is morally wrong to withhold interventions to prevent falls. Because researchers could not necessarily place a patient in a control group, only qualitative studies could be conducted. Once qualitative studies were reviewed, the investigators found few studies conducted with hospital-based registered nurses, nursing assistants, and direct care providers at the patient's bedside. They sought to find out why registered nurses and nursing assistants thought patients fall in acute care hospital settings and how they could be better prevented. The research focuses solely on nursing as the data and data based upon nurses and nursing assistants. For the variables, operational definitions for the variables were not given. We found that the independent variables in the study are the pre-planned questions and requests for clarifications about factors related to falls asked by researchers. The dependent variables are the thoughts and opinions of the registered nurses and nursing assistants. Registered nurses were asked questions such as, how do you know if a patient is at risk for falling? How is fall risk communicated to nursing assistants, the patient, visitors, and members of the interdisciplinary team? How do you decide which intervention to use to prevent falls? And how are planned interventions communicated, carried out, and evaluated? Now my partner Chris is going to go over the methodology.